Yeah. Surprise, we're starting.
Okay, everybody, guess who I am? No.
Go ahead.
Good morning, everybody. I'm Nancy Sasaki. I'm the Executive Director at Alliance Healthcare Foundation. We're really excited for this turnout. Thank you so much. We're excited to be able to bring you some information about Covered California and what's happening out here in Imperial County. I'm excited to learn about what's happening out here as well with all of y'all. Wanted to introduce some of our guests that are in the room. We have our County Board of Supervisors, John Renison, is here with us today. Thank you so much for coming today. We also have Bianca Velez, who is with Assemblymember Manuel Perez. Right here, yes, thank you for coming. And also Rebecca Terrazas, who's with Senator Juan Vargas. So again, thank you all for being here. And I'm going to turn it over to Sylvia Manuel, who is our program officer and has been the person that's most responsible for putting this group together and getting our speakers and everything, doing a great job of getting this information out to all of y'all. So welcome.
Thank you, Nancy. Well, again, good morning. Welcome, everyone. I'm really, really thrilled to see this kind of response that we had, and it would have been wonderful. We would have known we were going to have such a great response to have a bigger venue, but we made it work. I'm glad to see you all here. I have a lot of familiar faces and a lot of friends from childhood. I am from Imperial County, so it's so good to catch up with people I haven't seen in a long time when we have these gatherings. We're going to have a very, very productive morning. We have, a blue ribbon panel of speakers, experts on what's going on with the Affordable Care Act, all relevant to Imperial County. So you're going to get really, really valuable information today. And our goal is that you will take this information to your constituents, your family, your friends, your neighbors, because we know that's the best way of communication that we over and over has worked here in Imperial County and in many other Latino communities, which are usually the ones that need more hand-holding and being able to understand the process of how this is going to work. I'm going to run by you a few housekeeping items before we bring our first speaker. The bathrooms are to your left. There's notepads and pens on the table right there, because we are going to have the Q&A panel at the end of the 5 speakers presentation. So we want to make sure that whatever questions come up to mind, please jot them down so that you remember, because we're going to have them all together, and that way you're going to be able to, you can get all your answers, all your questions answered. Also, we will be passing a sign-in sheet. Just please make sure you fill out all your information so that whenever we have events, we know exactly how to contact you, your data changes. So just please make sure that everybody fills out those sign-in sheets. This started out, with an idea. This event was Nancy's brainchild. It's like, what's going on in Imperial County? Who's doing what? Do people know? Do we need to get involved? Do we need to convene a meeting? And so it started rolling from there. My first contact and the first person that I thought I should talk to was Robin Hodgkin, Director of the Imperial County Public Health Department. And she said, Sylvia, there is so much information that needs to be disseminated that I don't know. Maybe we should do a series so that we break it down. Well, unfortunately, we don't have that kind of time, and I know everybody's very busy, so we're doing the best we can with this workshop. So in addition to her being very willing to give me a lot of information that I was unaware of the situation and the population in Imperial and how they're going to get impacted with each one of the programs that are coming along during enrollment, she also was very instrumental in guiding me who else to invite for the session, who else was a key person that needed to be at the session. So I really, really thank Robin for all her help, and I couldn't have done it. And probably we had like 5 weeks to put it all together. So thank you very much. Let me introduce you. She is a very busy woman. I don't want to take any of her time. So Robin Hodgkin, Director of the Public Health Department, and she's going to be talking to you today about changes in healthcare reform. So please join me in giving her a round of applause.
crowd. How are we doing with my projection?
A little louder.
A little louder. How's that? I'll just keep drinking water, so I'll just keep pushing it out there. And welcome to Imperial County if you're not from here, and we're not used to this. Normally, we're not a swamp. Normally, we're a desert, and it's hot, but it's not quite as humid. I keep telling the people, when I see the alligator, I'll know that climate change is a little worse than we thought it was going to be. Great, thank you very much. Okay, so let's see if I get this in the right direction. I do, okay. So this kind of sums up a lot of what has been happening, what the discussion is around healthcare reform. There is a lot of confusion and a lot of disagreement about healthcare reform. Is it a good thing? Is it a bad thing? Is it going to stay? Is it going to be overturned? So there really is a lot of issues that still have not been resolved, and not everybody is on board with saying we need to change our healthcare system. So one of the things that I did want to point out in hopefully somewhat humorous way here is that there really is a foundation for this disagreement. It's more than just politics at work here. Healthcare is a very complicated thing, and particularly in the United States, there are some amazing things that we do and only we do well. We have some of the best health centers in the world. They are the envy of the world. At the same time, we have people that cannot access healthcare. We have people that have chronic diseases that are not being managed. Our longevity is less than South Korea. With the premier healthcare system in the world, that doesn't quite track. So how do we preserve that which is great, and how do we fix that which is not? There is a lot of debate still going on about that, but we have many provisions that are happening. We have many provisions and changes that are happening right now. So let me start going over some of what's going to be happening. When we talk about healthcare reform, everyone really talks about the Affordable Care Act, calls it Obamacare, all of those kinds of things. But healthcare reform is not one thing. Healthcare reform is a huge group of things that are all happening now. Some of these parts of healthcare reform started happening 5, 6, 7 years ago. Some of them are still unfolding and will not be implemented for the next 2 or 3 years. But when we talk about healthcare reform, we are talking about sweeping changes that impact our healthcare delivery system and how we manage our own health in this nation. So these are just some of them. And this really is not even a complete list, but the reason I use this background is it really is a forest of change. I'm only going to talk about 2 of those. I'm going to talk about medical managed care, and I'm just going to give you an introduction to the Affordable Care Act, which is really what this expansion of eligibility, the rest of the speakers will be giving you many more details about that. So Medi-Cal managed care. Most of the state of California, most Medi-Cal beneficiaries in the state of California are already enrolled in what is called Medi-Cal managed care. We are part of the state's, the coloration there only says 27, but there's actually 28 counties that have remained in what's called traditional fee-for-service Medi-Cal and will be transitioning to Medi-Cal managed care. So our very important go-live date is November 1st. So that's a date everyone kind of keep in your mind. So this is a change that is happening now, and it is a change that is going to happen before the expansion of eligibility that will happen under the Affordable Care Act. So what is Medi-Cal managed care? Okay, so right now, when you are eligible for Medi-Cal, you go over and you see the wonderful people at Peggy Price's department and say, hey, you know, I need health care insurance, I need access to health care, and they do the eligibility, and ultimately someone gets a Medi-Cal card. Once they have this Medi-Cal card, that's what they have. They basically have a card. So how do I get to a doctor? So you go in the phone book, you start dialing different doctors, you try and get in someplace, and nobody takes Medi-Cal. And you call, and you call, and you call, and then you finally hopefully call Clinicas, or you call one of the hospitals at the rural health clinics, and maybe you can get an appointment at some point in time. But that really doesn't do much for you when you have a medical condition like that. So there is actually the actual definition of what managed Care is, which is basically an organized system of care. It is not an HMO. Kaiser is an example of a health maintenance organization which is coordinating care within one organization. Medi-Cal Managed Care is, or Managed Care, is coordinating services across multiple organizations, multiple providers in a community. So it is a community organized system of care. So, what's the difference in a little bit more detail? Number one, you have a medical home. When you enroll in Medi-Cal Managed Care, when you get that card, you also get, where can I go get my care? Somebody helps you find a place to go get care that will actually see you and begin to take care of whatever medical issues that you may have. There's also a health plan, and we'll be talking a little bit more about what a health plan is. But right now, when you have a medical card, you basically have a card from the state of California. Under Medi-Cal Managed Care, you ultimately still are the state of California, but there is a health plan that helps to coordinate all of the resources and works with your medical home to ensure that you have access not only to your primary care, but also specialty care and tertiary care. This is a text-heavy slide, sorry about that, but I had to get some of these in. So the other thing that happens right now in fee-for-service Medi-Cal, no one knows how well it's working for anybody. There really is no reporting of outcomes. Are people getting better? Are they getting their health care conditions managed properly? Are they getting sicker? Are they getting better? What's really happening in Medi-Cal Managed Care? There's a significant amount of reporting, monitoring, looking at what health outcomes are really happening within the population. And right now, if you're not happy with your provider, you're not happy with the care that you're getting, you're not happy with Medi-Cal in general, which, you know, is a fairly common statement, there's no place really you can go. Under a managed care system, there are significant numbers of grievance, contact people, people outside the medical system that you will have access to if you are under Medi-Cal Managed Care. So what are we talking about? We're talking about the existing Medi-Cal population that will be transferring from fee-for-service into Medi-Cal Managed Care. These are the numbers of the existing Medi-Cal population in our community. For Managed Care, the mandate for the 28 counties that are doing the transition are for this population right here, families and their children. The other population groups can voluntarily enroll at this point in time. Within the next year or less, they will be also mandated to transfer or transition from the fee-for-service model that they're currently under into managed care as well. So you'll start hearing numbers about the Affordable Care Act's expansion, but what we are talking about that's happening right now is a transition in a totally different system of care of over 35,000 people. Okay, so we in Imperial County, when we receive this mandate from the state, you are part of 28 counties, you are going to go from your traditional fee-for-service and you're all going to transfer over to Medi-Cal Managed Care. Our community came together under an organization called the Health Leadership Forum. So the Health Leadership Forum was in place prior to this. We have been working on issues such as electronic health records, what's called meaningful use. If you guys are in the healthcare field, you know it has a lot to do with how you exchange electronic health records. We were working with establishments of low-income health programs in anticipation of healthcare reform. They also adopted the leadership for this transition from fee-for-service to Medi-Cal Managed Care. We have been very active. Out of all of the 28 counties, we are the most active, as Dr. Begg knows, because she gets to come to all of these meetings. And we actually just on Monday had the state leadership for Medi-Cal here in Imperial County, saying we want you on the eve of us going live and coming and talking to us about how it's really going here in Imperial County. So we didn't just give it up and over to the state and say, do what you want. The healthcare system came together, including an amazing number of physicians, came to the table to say, if this is going to happen, we are going to ensure that it happens well in our community. So, the Medi-Cal managed care model in Imperial County is what's called a two-plan model. We are going to have what's called a local initiative health plan. This is a health plan. We interviewed lots of health plans that were interested in coming to Imperial County. Amazingly enough, there were lots of health plans who were interested in coming to Imperial County. And health plans are very much like what you would have if you had private insurance. Health plans, one is Anthem Blue Cross. They have a medical managed care product as well as many of the commercial products that you may be insured if you have insurance through your work. So there is a variety of health plans though that just specialize in what in the nation is called Medicaid, but they specialize in Medi-Cal products and they operate just solely to provide managed care for Medi-Cal populations. So we interviewed a lot, we talked to different plans. What would you bring to our community? How would you help our Medi-Cal beneficiaries? How would you improve the health of this community? How well can we work with you? Do you understand rural? Do you understand isolation? Do you understand that there's not enough doctors here to get and see people? What are you going to do about that? What are your programs? So we picked what we felt was the best plan. It's called California Health and Wellness. They're new to California, but they have a lot of experience in rural areas across the nation, and one of their largest operations is in the Texas-U.S.-Mexico border area. So they understand border, they understand Latino, they understand rural, they understand isolation, and they also have some very, very good programs. So that is one of the health plans and the reason that we selected them. The state in a two-plan model also has the option to pick what's called a commercial plan. Medi-Cal beneficiaries are required by the federal government to have choice. They may like one health plan who provides better transportation. Here's one of the things health plans do. You cannot get to your appointment because it's at Rady's, because your car is not going to make it up at the grade on a day like today. They also are required to do things like assist you in making sure that you can get to your appointments, that there are things like the transportation barriers, I can't take time off work, I need after-hours appointments. All of those things are things that health plans are required to address to help Medi-Cal beneficiaries access the kind of health care that they need. Our local initiative health plan also will work with our provider community very directly. We've already started talking to them about some of the initiatives that we need in our community. We know that diabetes is an issue in our community. We know that asthma is an issue in our community, particularly pediatric asthma. We are talking with California Health and Wellness not just about how the medical care will be delivered to populations with chronic diseases, but how are we going to help prevent, and how are we going to help manage at a community level, not just at an individual healthcare level. So our local initiative health plan, California Health and Wellness, and the commercial health plan selected by the state, unfortunately selected 2.5 weeks ago, so they're kind of new and scrambling, is a health plan called Molina. If you've ever received any health care in Riverside, they operate in Riverside County, and they also operate in San Diego. They pretty much operate all through Southern California with the exception of Imperial County, and now they're going to be operating in Imperial County. The reason I start with this, because as I said, healthcare reform is more than just the expansion that you're going to be talking a lot about. It is things like this transition in redefining the healthcare system. The reason I'm talking about it is that it's happening right now. Medi-Cal beneficiaries have been issued a notice in the mail that says a change is coming to your Medi-Cal system, and you have a choice to make. You are moving from fee-for-service to managed care, and that means that there will be a health plan that will help coordinate your care and ensure that you have access. You have the right to select which health plan you would like to join, and that selection needs to occur by October 25th. Should you not choose, a choice will be made randomly for you. And the challenge is, number one, many people are not going to know what that means because the Affordable Care Act expansion is on everybody's radar. It's on the news, you turn on the TV, you're hearing all the arguments, you know, that's on everybody's radar. This is something that really isn't on anybody's radar. It's very new for us. It's not very new for the rest of the state of California, but for our community, this is a very new issue. But one of the other problems with a default is that these are random defaults. So people will be randomly assigned. There is no familial association in a random assignment. So I have 2 children. Child 1 could be in California Health and Wellness, and child 2 can be in Molina. Child 1 may get the transportation that they need because the transportation program that California Health and Wellness sets up works for it, but child 2 doesn't have the transportation because Molina has a different transportation system. Now, Medi-Cal beneficiaries can change at will. So it's not like a lot of people with health insurance, you sign up once, you're stuck for a year, you have to wait a year. Medi-Cal beneficiaries can change at will, but the request to make a change from one plan for us, from California Health and Wellness to Molina, or from Molina to California Health and Wellness, takes a while to process. So it's going to take a minimum of the next month, and most likely up to 45 days to process that transfer. So choice is incredibly important. Informed choice is very important, and getting the message out that now is when the choice is happening, I think is very important to get out to our community. Okay. Yes.
Could you speak a little louder?
Okay, I'm still not projecting enough. I apologize. I'm sorry, Rosie, you're going to go deaf. Okay, all right. So that was, and I'm sorry, I'm not going to be able, I'm giving you this actually, I got this one for 3 times today. I don't know how the schedule worked out for us, so I'm going from this presentation to another. So I'm just going to stop briefly on Medi-Cal managed care. Are there any questions before I move on to the Affordable Care Act expansion? Yes.
If the default is different for 2 children, with the example that you gave, is there going to be a way to help that family make those changes? Are there going to be technical assistance to help with that?
Yes. So the question is, what happens when you have an assignment that's not working for your family? Say your children are in different health plans. There is a group who is here, so if y'all will, it's called Healthcare Options. Can you stand up? Healthcare Options, there we are. So I asked Healthcare Options to be here, and I'll actually start going over some of the resources at the very end. Healthcare Options is the organization for the state of California to help Medi-Cal beneficiaries make their selection. They have a variety of resources, and they're going to be here after the presentations so you can ask a lot of questions about how do we get the help, how do we do this, how do we talk to you in person, how do we talk to you on the phone, and if we choose, how could we go on a website so that we can make an informed decision and figure these things out. So, yes, absolutely. Yes.
If a beneficiary changes their health plan, what will the effective date be? Would that be retro, or would it be the following year?
It would be the following month. If you make a selection, a beneficiary makes a selection to change health plans, it will be effective the following month in which it's been processed.
Robin is the only speaker that's not going to be here for the end of the day for the Q&A. So if you have a question, go ahead and ask it for this particular part of the presentation. But please speak loud so that the rest of the people can hear you, because they may have the same question as you, and then they'll get the answer from Robin.
So all of the current persons that are enrolled have received a letter under
Yes.
assumption. And if they don't act prior to the 25th of October,
Yes.
then they are going to get enrolled in one of the programs automatically. As a community, do we have an opportunity to advertise in advance and let them know that we can help them with that enrollment?
There are a lot of rules. So basically, what can the community do to help Medi-Cal beneficiaries with the selection process to ensure that they are making whatever informed decision is best for them? The federal government does have a lot of restrictions, particularly on the health plans, around marketing, because they do not want health plans to come in and do the kind of marketing that would sway them for the wrong kind of reasons. But as a community, outreach is something that we can do. So it's very difficult for us to advocate for one plan or another, but the ability to talk with our community about a choice is here for us, here is what the choice is, and here are some key pieces of information about each health plan so that you can understand this to make a selection that's best for you. This is what Healthcare Option does, but as a community, it is also our ability to get that outreach information out. So yes, we can. And as soon as we have, and again, this is happening so fast, we don't even have those materials yet. So we do not have the list, the approved list of here's what California Health and Wellness options, the key options are, and here's what Molina's key options are. As soon as that's available, I can send it, if you'd like, to Sylvia, just these packets, so that you can help inform our community. The choice is here today, and here's what this choice is. Advocating one way or another, not our role. Providers may, healthcare providers may advocate, but the community and healthcare options, not really our role yet, and the health plans cannot. At some point, they will be able to advocate and advertise, but not at this point in time. Yes?
How will this affect like the CMSP patients, the county?
Okay. This is where we're going to get into. She's asking, how does this affect the CMSP patients? That's the California, the County Medical Services Program. And that is a medically indigent adult program for people who are low income that are not eligible for Medi-Cal. They can be eligible for the low income health program called CMSP in our county. CMSP will end at the end of this year, and all of the people who receive benefits under CMSP will be transitioned into Medi-Cal because they will be eligible for Medi-Cal. That's part of the healthcare expansion happening in 2014.
If someone is enrolled in California Health and Wellness Program, you see the availability of physicians increasing, decreasing, or staying the same? Access to different.
My understanding, the networks are still being developed. Both health plans are going through what's called readiness standards. One of the things they have to put together and demonstrate to the state is how prepared are they to serve the Medi-Cal beneficiaries. If I show up on November 1st, our go-live date, to a doctor, to a clinic, to wherever I show up, are you ready to be served? And are these health plans ready? My understanding of the network development is Molina is kind of scrambling because they're later to the table, but they do have very strong networks in Riverside and in San Diego, but they need to develop one here. And my understanding is California Health and Wellness has expanded the traditional Medi-Cal service providers. There are more physicians and practices that are now willing to serve Medi-Cal patients through California Health and Wellness than without them. But the safety net, clinicas, the hospitals, the rural health clinics, the Ivy Women's Center, pediatricians are all coming on board to make sure that they are signed up with both health plans because they know they serve a vulnerable population. Okay, I'll do a couple more so I don't want to get in. Sylvia, tell me when you want me to move on. I've got just a little bit of introduction so I don't want to take everybody's time. Yes?
Yes, I'm a little confused about the CMSP. Is that part of the LIHP umbrella?
Okay.
Or is that?
CMSP that we talked about, this was a question about CMSP and the low-income health program. CMSP, again, medically indigent adult program, expanded in anticipation of healthcare reform. So for the last couple of years, the eligibility for the CMSP program was more inclusive. And so it started to mirror healthcare reform standards under Medi-Cal. All of the CMSP enrollees will all be eligible, including the low-income health program people, the LIP program people, will be eligible for Medi-Cal, starting January 1st of 2014.
Because I know in our county, Riverside County, we have the, what's called the MISP, which is the Medically Indigent Service Plan.
Yes.
That is not going away. And
It
then we have
is,
the
I mean, it's not going to
RCHC.
go away in the sense that CMSP is no longer going to be CMSP. The CMSP and your medically indigent adult program will change significantly because at this point in time, most of the population will be eligible. But I will talk about upcoming, here is a slide, that will talk about what's called the residual population. There will be a group of people that the expansion does not include. And yes, these programs will be here to serve that smaller population. So don't, yeah, I apologize, I made it too sweeping of a comment. It will, in general, be not like it was, but there will still be a small population that needs to be served. So I apologize for that. Okay, maybe one more and then I'll get down to the healthcare reform. Yeah.
Simple clarification, when you're saying the CMSD is going to be bundled into Medi-Cal, you're talking about one of the two programs.
Medi-Cal is still Medi-Cal, but what I'm talking about is the way Medi-Cal is designed, absolutely. So they will be eligible for Medi-Cal, and because we are transitioning prior to 2014 into a Medi-Cal managed care system, that expansion population come 2014 will need to select one of the two Medi-Cal managed care health plans, yes. And that's one of the reasons the state is pushing and rushing us to implement Medi-Cal managed care prior to the expansion. So it will be in place, so all of the newly eligible beneficiaries will have a health plan and a system already in place to enroll in.
And fee-for-services can cease to exist also.
Fee-for-service will be here for some time. There will still be some of the populations, like the seniors and persons with disabilities, what are called dual eligibles, Medi-Cal and Medicare eligibles, that will remain in fee-for-service for probably up to a year. Ultimately, we believe there will always be some degree of fee-for-service. Not everything can be incorporated into Medi-Cal managed care. Okay, healthcare reform under the Affordable Care Act. Okay, so the Affordable Care Act is not new. I think we all kind of think, you know, maybe sometimes it's new. It was signed into law in 2010, and it was upheld by the Supreme Court in 2012. These are basically the purpose: expand health coverage, improve coverage terms, hopefully to improve health care, and ultimately, you know, I'm from public health, so I always call this the gold standard: improve health. If we're not improving health by improving our health care system, it's not working right. Okay, so I said I'd come back to this. This is what is not included. So this is not a public option. As I said, you know, there's not consensus. There's still a lot of argument. Is this the way we need to reform our healthcare system? Is it not? There is not tort reform. What that means is medical malpractice has not been addressed. Many people believe that that type of litigation is a big reason why healthcare costs are being driven up in our country. Insurance rate controls are not in there. And then the last one here is a big one for Imperial County. Undocumented immigrants will not be part of and covered through the expansion of the Affordable Care Act. So there will be the residual that will need to be provided coverage and access through county-funded programs. So a lot of provisions have already gone in. And you know, this was designed to be implemented over several years. Some of the more popular things that people were, in general, pretty much agreed upon, that's not a good thing to do. Those provisions already went into effect in 2011. Exclusions for pre-existing conditions for children. The mom and dad get a new job and the child has asthma, the child can't be insured. Mom and dad can't get a new job if my child can't get insured. So some of the provisions that were in place by many insurance companies, kind of the industry standard, were changed, and those changes were effective in 2011.
I have a question. Just with regards to the limits, the yearly caps, those do not apply to employer-provided benefits in Mexico. Is that, it's a question.
Okay.
Or do they apply?
So some of the provisions of the Affordable Care Act where they're talking about no lifetime limits and some of the caps on services, does that apply to the insurance programs that have coverage in Mexico? So now that I repeated that, I don't have the answer. I'm not sure. I am not sure. I believe that they probably will, because if they are covered under an insurance program in Mexico, that network is developed by a plan, And there's a variety of plans that they have, Western Growers and a variety of different plans have networks in Mexico. The County of Imperial has one, IID has one, I mean, it's a very common thing. But they are governed by the plan. The plan has to put certain requirements to be approved to have that network. I would guess that this would be there, but I'm not going to say for absolutely sure. But my belief is yes, because this will govern US-based plans. And it's US-based plans that are putting together these networks. So that's my belief. Okay. So what you're going to hear about for the rest of the morning and discuss a lot about is some of the things that are happening in 2014. The expansion of Medi-Cal, so I just kind of highlighted some of them because there's a lot of things that happened in 2014. And this isn't the complete list of what is going into effect in 2014 under the Affordable Care Act. The insurance exchange becomes operational. Individuals are going to be required to have health insurance. But if you see right here, this has been delayed. The employer mandate has been delayed. So there are still things that are changing, even though we're really moving up very quickly to January 1st of 2014. Okay, so who's going to be impacted by this change in the medical population? In the medical population, we are estimating somewhere around 20,000 people who currently reside in Imperial County who are not eligible for Medi-Cal will become eligible for Medi-Cal in January 1st, 2014. Those include people covered under CMSP, include the people covered under the Low-Income Health Program expansion of CMSP, and it covers many people at this point in time who have no coverage whatsoever. Okay. So here's, I'm going to try in one slide to impart something here to kind of close this up. Okay. What can you do? What do we need to do here? The first thing is to work with ourselves, because we are the ones that are going to go out and help to provide information to our community. One of the things we have to realize is the changes are going to continue to change. It's not done yet. This stuff isn't all written in stone. Just the example of the employer mandate, which has been there since 2010, suddenly gets delayed. Will the individual mandate get delayed? I don't know. But changes will continue to happen. There will be refinements. There may even be outright rejection. So that we are comfortable that changes are going to continue to occur, we need to be as flexible as we can be and continue to be as positive as we can be. So all we can act on is the best information that we have at that point in time, and when a change happens, it doesn't do us any good to impart to our community the frustration of get it straight. Because as I tried to convey early on, this stuff isn't easy. This is very complicated. Protecting what works while fixing what's broken is not easy. Even if we had a wonderfully functional political system that everyone got along and bipartisan cooperation, and even in the best of times, this is not an easy thing. So as it unfolds, changes will happen. Being able to anticipate that and be able to work with that will be very helpful when we're talking to the community. Many of the people that you are going to try and reach out to may not agree. I don't want anything to do with that. If it's Obamacare, I don't want anything to do with it. I anticipate many people who received the notice for Medi-Cal managed care will, Obamacare, and threw it away, not even realizing that this has absolutely nothing to do with healthcare reform under the Affordable Care Act. So acknowledging that there are controversies and granting that there are intelligent, legitimate disagreements that need to be respected, but we also need to say what will work right now for the beneficiary and for the people. So understanding and respecting that controversy and expecting that you may hear that and figuring out how would I address it, I think will be very important. Okay, so it's one of those hurry up and waits. A lot of changes are going to happen really rapidly, For example, you've got till October 25th, you've already got your notice, you need to make a plan selection, you don't make one will be made for you, now figure it out. Some of it, particularly the expansion of the Affordable Care Act, there are going to be many of our community members who will not want to or even address enrolling, even though they're eligible for another couple of years. Change doesn't come to people at the same rate. And the programs that are changing are not all changing at the same rate. Some provisions are still coming in. Some changes are still being made. So there's a lot of hurry up, there's a lot of wait, there's still anticipation. Why isn't it here yet? And the change at the individual level. Some people will be here October 1st and Peggy Price will let you know about early enrollment under the Affordable Care Act expansion. There will be people at the door. There will be people saying January 1st, I'm here, where is it? And there will be people in 2016 going, maybe. Okay. Become involved, become informed. Thank you for being here. This is a great way to start getting involved and becoming informed. And then the last one, which I always, we always need this, and this is what y'all got handed out, because I hate it when you all have to try and write, because I never get it right when I'm trying to scribble this down, so I handed it all out to you. The other presenters will start giving you information about the Affordable Care Act expansion, who to contact around this. This is the information and healthcare options. Did I get you right? At least I got somebody in the room I can ask. These are the contacts for the Medi-Cal managed care transition. And if you don't have one, I think I brought extras. This should be handed out to you so that you can have it. Did I do okay on my timing? I think I did my time. So, any other questions before I get to head out?